Hello. I'm gonna. So many times people have walked up to me and asked me what post-polio syndrome is. I thought maybe I could educate a few people. Post-polio is a condition that affects approximately 25 to 50% of people who have previously contacted polio, a viral infection of the nervous system, after the initial infection. Typically, the symptoms appear 15 to 30 years after recovery from the original paralytic attack at an age of 35 to 60. Symptoms include acute or increased muscular weakness, pain in the muscles, and fatigue. The same symptoms may also occur years after a non-paralytic polio infection. The precise mechanism that causes PPS is unknown. It shares many features with chronic fatigue syndrome, but unlike that disorder, it tends to be progressive and can cause loss of muscle strength. Treatment is primarily limited to adequate rest, conservation of available energy, and supportive measures such as leg braces and energy-saving devices such as powered wheelchairs, pain relief, and sleep aids. The mechanism on it is numerous theories have been proposed to explain PPS. Despite this, there are currently no absolutely defined causes. The most widely accepted theory of the mechanism behind the disorder is neurofatigue. A motor unit is a nerve cell and the muscle fibers it activates. The poliovirus attacks specific neurons in the brainstem and the anterior horn cells of the spinal cord, generally resulting in the death of a substantial fraction of the motor neurons controlling skeletal muscles. In an effort to compensate for the loss of these neurons, surviving motor neurons sprout new nerve terminals to the orphaned muscle fibers. The result is some recovery of movement and the development of enlarged motor units. Management. The treatment for post-polio syndrome is generally palliative and consists of rest, pain relief, and utilization of mechanisms to make life easier, such as powered wheelchairs. There are no reversive therapies. Fatigue is usually the most disabling symptom. Energy conservation can significantly reduce fatigue episodes. Such conservation can be achieved with lifestyle changes, reducing workload, and daytime sleeping. Weight loss is also recommended if patients are obese. In some cases, the use of lower limb orthotics can reduce energy usage. Medications for fatigue, such as have not been found to be effective in the management of PPS. Muscle strength and endurance training are more important in managing the symptoms of PPS than the ability to perform long aerobic activity. Management should focus on treatments such as hydrotherapy and developing other routines that encourage strength but do not affect fatigue levels. The recent trend is toward use of intravenous immunoglobulin, which has yielded promising but modest results. PPS increases the stress on the musculoskeletal system due to increasing muscular atrophy. A recent study showed that in the review of 539 PPS patients, 80% reported pain in muscles and joints, and 87 only had fatigue. Joint instability can cause significant pain in individuals with PPS. Should be adequately treated with painkillers. Supervised activity programs, decreasing mechanical stress with braces, and adaptive equipment is recommended because PPS can fatigue facial muscles as well as cause difficulty in swallowing and speaking. Persons with PPS may become malnourished due to difficulty eating. compensatory routines can help relieve these symptoms, such as eating smaller portions at a time and sitting down while eating. With respiratory involvement requires special management, such as breathing exercises, chest percussion with a stethoscope on regular occasions for observation of the disease and management of secretions. Failure to properly assess PPS with respiratory involvement can increase the risk of missing aspiration in an individual. Severe cases may require permanent ventilation or tracheotomy. Sleep apnea may also occur. Other management strategies that may lead to improvement include smoking cessation, treatment of other respiratory diseases, and vaccination against respiratory infections such as influenza. And that's about it, really, about all you need to know concerning PPS. Thank you.